we're going to go into our last presentation for the day. It is our 1:30 to 2 o'clock session on the topic of process of developing the Foundry app and co-design process with youth. We have our two speakers ready, I see, and I would just like to introduce them for us, please. Our two speakers, speaker number one, we have Suhail Nanji. Suhail is a passionate healthcare worker and leader with experience leading strategies regional and provincially related to system change across the mental health and substance use systems of care. Suhail has a keen interest in the transition to digitally enabled healthcare system. And our second speaker who will be joining Suhail is Al Raimundo. Al, prior to working on the Foundry BC platform, Al has worked for 10 years co-designing awesome mental health apps, programs, and policies. Al is a thought leader for their work with over 1,000 speeches worldwide, including the United Nations World Youth Day and Canada's Senate and federal government. They have also been quoted in Vanity Fair, the Globe and Mail, and other newspapers all over the world. Please welcome our two speakers. Over to you two.
Great, thank you so much, Ben. Al, your bio is so much better than mine, and I think well-deserved. I often say Al is the coolest person I know, and they have TED Talks and all this stuff. So I'm excited that we're both able. I'm very lucky to work with Al in the last 2 years, and excited to do this presentation with Al. And maybe I will just start sharing my screen. Oh, Al said we're equally cool. Thanks, Al. Yeah, thanks so much for that introduction, Ben. Again, I'm Suhail Nanji. I use the pronouns he, him, his. I'm with Foundry. And I'll let you quickly introduce yourself.
Hey folks, my name is Al. I use they, them pronouns, and I am a business analyst with Foundry.
Great, thanks. And I'm one of the leads with Foundry. And one of my specific portfolios is around digital health and the scale of digital technologies like our Foundry BC app. And I certainly want to just take a moment to also acknowledge that, yeah, both Al and I are on the unceded, stolen, and traditional lands of the Coast Salish people, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. So thank you for allowing us to be in your space today too. I think we're the last presentation. Hopefully it's been a fruitful day for everyone. So I think what we'll start with, our first slide is recognizing that maybe folks actually might not be familiar with Foundry itself and our organization. And so I wanted to just do a quick introduction and give a high-level context of where we're coming from. So Foundry, we offer young people ages 12 to 24 health and wellness resources, services, and supports through integrated youth services centers, also our Foundry virtual clinic, which we'll speak about, and the foundrybc.ca website, which is all here. So you see a picture on the left, I guess my left, I think that's everyone's left too, of our physical center space. And just want to acknowledge that these spaces are co-designed by youth. And then in the middle, we have a bit of a tease on our app, which you'll get a demo later, which is exciting. Again, co-designed by youth. And then the right is our website, which again is co-designed by our youth and caregivers as well. And I just wanted to quickly touch on integrated youth services centers. I think that's really important. It's a new model of care, relatively new. We're certainly leaders in Canada and the world around this integrated youth model, which involves, I know it's not the best terminology, our communication sometimes get mad by using this, but a one-stop shop. So one-stop shop for mental health, substance use, primary care, physical health, peer support, youth and caregiver family peer support, and social services. So again, that's an integrated model that we have in our physical centers, our app as well, which we'll speak about. Oh. And yeah, just further context, just want to give a bit of a level set of who we are and our reach, and recognizing that Foundry is a provincial program. And so we have 13 physical brick and mortar centers open right now. So let folks kind of just give a browse on those centers that are open. And recognizing that it's a mix of urban centers and then also rural remote communities as well, which is really important to us. And on the right there, recognizing that we have 6 coming soon that are publicly announced, and then 4 in development as well. And then on the bottom there, little italics, that's our Foundry Virtual BC program. And so that's the result of COVID, planning before COVID, but certainly a catalyst of COVID, is a decentralized team of over 30 staff across BC that provides purely virtual services. And that's done through our app. And so now, this is a digital health talk. We want to talk about our digital health technology. And so the Foundry BC platform is what we're going to be talking about, and specifically the co-design work that was put into it and has led to kind of a successful implementation and engagement of the app. And so again, setting that context of what do we mean by the Foundry BC platform, it's important to acknowledge that it's all of these things in the bullet. So it's an iOS app, it's an Android app, it's a web app, and it's also, we have a 4th portal that's specific for staff, which is web-based and with two-factor authentication. And I think it's really important to acknowledge that these Android and mobile apps, and I know Al can speak more into this, but recognizing when engaging with youth, web app is not enough. Not being like in terms of safety and stigma, like and access and convenience and flexibility, those mobile apps were really important. Yeah, and then again, a tease on what the app looks like, but just want to center us in where we deployed the app currently. So currently being used by 2 centers, again, that Foundry Virtual BC, so a decentralized team across BC. So their only entry point is virtual. We only provide virtual services. Again, those core services, those 5 that I talked about, mental health, substance use, peer support, social services, and physical health, those are all on the app with an integrated team across BC. And then excitingly, we've launched our first brick and mortar center, recognizing that this is purpose-built for virtual, but we got feedback, and our plan was always to roll this out to the centers. As we took 4 months, we took a step back, did discovery work with our centers, and had to figure out in the back end also technically, and then also workflow-wise, how do we create a hybrid platform now where we can do both virtual visits and also scheduling in person. So just pause there. I'll maybe throw it to Al if you wanted to add anything here on the kind of higher level context of the app. And then I know we're going to go into features in the next slide. I'll pass it off to you.
Yeah, for sure. And I think we'll talk more about this later, but having 3 options for young people and caregivers to use the app, use our platform is a piece of co-design. Just knowing that so many of our young people and caregivers, where their safe space where they can access services is, may not always be at home. And so having something that can go in their pocket is good, but then also having web options for people who do have a safe space in their home or a safe space in community to access services is important. And then it's just one of the many ways that we have co-designed this platform. Is it was something that we really did hear from young people and caregivers to give them options. And as people are connected into one platform, that account exists on all of the platforms, so they can go in between as it makes sense for them. So the Foundry BC platform and currently has it has a lot of awesome features. One of the most important ones is the ability for young people and caregivers to schedule appointments themselves. This does not require them to call. This does not require them to walk into a Foundry center to be able to schedule an appointment. They can do so with the appointments that Foundry center has configured as publicly bookable. So it's one of the really cool things to see from, as Suhail will talk about, from our data, but there we see a lot of people who are having rough nights book appointments for the next day or for the next couple days in the middle of the night, so that they feel a little bit more comfortable knowing that they'll be able to talk to somebody soon. And they're able to book virtual and in-person appointments with if their Foundry, when their Foundry center is on the application, and it can offer them the in-person appointments. Another really awesome idea that was championed by young people, caregivers, and actually our service providers is called Inbox. And so this is, and I'll show this later, it's a way to asynchronously message with your service provider. So your service provider opens the conversation, the young people can respond, and then once the conversation is complete, the service provider closes it so that young people and caregivers are not sending messages when that provider is not online. And there's other places they can send they can reach out for urgent services, and I'll walk you through that in the app later. Our app is very configurable for Foundry centers. Folks can create the roles, appointment types, and subtypes that they so need for their center, and decide which of those is bookable only by their colleagues, and which of those with the young people and caregivers can book publicly as well. So that's all kind of configurable on their side. We also have a drop-in service that has manual triaging, so we can triage on things based on like K10 scores, location, the last time they access services, and within those different tiers, there's 3 buckets. People then are placed in a first come, first serve kind of waiting list. So if somebody comes in, if there's 3 people waiting and someone who comes in is in crisis, we can plop them to the top of the list, and folks would know to see them first. We also have a feature called My Story, which is something that we had heard a lot of from young people and families, that they were tired of every time they'd see a new service provider having to retell their story. So this allows the young person or caregiver to put their treatment journey so far in a story and share it with service providers ahead of the appointment. That is then, it has a character limit that we had done some research about, and so it'll only ever take 5 minutes for the service provider to read at a maximum. And we have, when we set up appointment types, we have this thing called pre-buffer time and post-buffer time, which allows service providers, us to build in time for the service providers to read not only My Story, but in the EMR entries or any other data that we may have on the young person or caregiver. And then we also have post-buffer time so that they can document, write notes, debrief if they need to, and or sometimes it's just as simple as going to the washroom and getting a snack. They can be booked very back to back, so it's a little kinder on the service providers. With the young people and caregivers can switch between the Foundry Virtual BC service that Suhail talked about, as well as their local center. The services that folks offer may not be exactly the same. When Foundry centers are starting up, they may not have all the services or may not have capacity. So virtual is oftentimes also supporting folks to access those services if it's not available in their local community. And sometimes young people have a preference. They want to access in-person services, or they want to access virtual services. And so they can switch between the centers for whatever service is more accessible for them at the moment. Lastly, and this is quite complicated, but I'll summarize it very quickly. We have a data collection platform called Toolbox. Toolbox is where anything that we know, any kind of statistics that we're able to pull from the platform, Toolbox is where we get it from. And normally when you're booking appointments and stuff, you would have your admin team go in and create the entry on Toolbox for that young person and add a visit and all of that stuff. The platform does that automatically for folks. And it reduces the amount of platforms that our service providers need to sign in on, because once they complete a service on the platform, they just click one button. The survey they need to fill out at the end of every service is popped up for them. They can complete it there and then go back to serving folks. So it's way more complicated than that, but that is my fast summary at this point. So go over to the next one. So just for some history and timelines, we have been working on this platform for quite some time. It was something that people were talking about way back in 2016, but the active planning and working on it started in 2018. When we were working on it, when COVID hit, and when COVID hit, we needed to roll something out faster than this platform was going to be ready for. So we launched an interim service in March of 2020. As many people I'm sure have experienced, we were going to launch this small in a pilot program, and then COVID hit and they said, how about you launch it for the entire province? So we made the platform really super solid and launched it in March of 2021 with the ability to book appointments, My Story. And the next month we launched the drop-in queue. And then in August, we launched Inbox. And then in June, we launched a lot of the configuration features, as well as the ability to switch between centers. And we went live with our first center with that feature in July of 2022. And there's a large population of young people who have only consented to see Richmond, only consented to see virtual, and a mighty group of folks who switch between the two. We can go next. This is over to Suhail now.
Oops, muted. Yeah, and I'm just recognizing 15 minutes goes by fast, eh? But I guess when we're passionate about it. I'll zip through these because I certainly want to get to the demo and speak, you can speak more to the co-design, which is, I think, is just so critically important. But just to give an idea that Al mentioned, we know there's a need in terms of accessing services, and it was proven out by the platform. And I think a big reason was that because of meaningful co-design. But just showing the numbers here, that March 2021 that Al mentioned was our launch. And then you actually see a spike here 1 week. That's when the Minister of Mental Health actually announced this. And then it got picked up organically by, I think, 10 or 12 news outlets across BC, the app. And we just see continued growth. I think that was the main kind of takeaway from this slide is we have sustained engagement. So each week we're having hundreds of registrations on the platform by young people. And now we have over 15,000 appointments booked through the platform, which is exciting. And then here, that was more the quantitative, qualitative, which again, as we know, is very important to kind of tell the story of what we're doing here. And we are getting that engagement in terms of utilization, but then also we are like, and with a caveat, there was only 30 youth interviewed on the top here, but anecdotally, like it's a great experience. And not only the app, but then the service behind the app. And again, those services were co-designed by youth, and a lot of the groups and service offerings are led by youth peer supporters, for example. I think this quote is just really important in terms of access. Please keep virtual in some sort of form after the pandemic comes to a close. I'm not sure if it exists pre-pandemic or plans to continue post, maybe both, but I live in Tsawwassen, so they don't have a Foundry center there locally. And I'm in the iron grips of a bleak job. Not having to commute to a physical location is what lets me make use of this resource. I can imagine that plenty of other people in positions similar to mine can greatly benefit from the ease of setting aside 45 minutes at home instead of planning an entire part of the day when it's already so hard to muster the energy to make new offerings or different plans a lot. I think these principles of meeting the youth where they're at and leveraging this type of technology is certainly a success. And then quickly here, the who. So who's accessed the platform? Again, Foundry's 12 to 24-year-olds and their caregivers. So I won't go too much into age registration, but I think it's really important to acknowledge, especially kind of the theme around empowerment, equity, and inclusion, the orientation of youth that are identifying their sexual orientation, and looking at that split where we have actually less than 50% that are identifying as heterosexual, and we have quite a bit of diversity. And I think that speaks to the service offering and service offering and supports that are on the platform, again, led by the youth. And I think these anecdotes are really important. So I just want to pass off to Al quickly. I know you just presented on Queer Cafe at an International Youth Mental Health Conference. And just a quick anecdote maybe of how that kind of fits in within that step care model of youth and being inclusive within our Queer Cafe offering.
Yeah, so one of the services that we offer, that Foundry virtual offers, is called Queer Cafe, and it is a group that is kind of focused towards the LGBTQIA community and is supporting folks to start to have a community. And so it started from young adults on our co-design group that we'll talk more about later, talking about how even when there were resources in their towns, that oftentimes that accessing those resources kind of forced them out of the closet. And so having something that's virtual, that is happening, is like hosted online, where they can play with their identity and try on labels and see what makes sense, made a lot of sense. And this Queer Cafe is really unique because they cover some really serious topics, but they also cover really fun things. And they've also done a lot of works with like elders and indigenous counselors and things like that. And so it's been really cool, and it's something that helps young people who do not live in Vancouver or another big city that has a gayborhood, as it was, to find that community. It helps them get access to that community in a safe place to like explore. So that's I think one of the reasons you would see such a large diversity in terms of identities with this platform.
That's great. Thanks so much, Al. Just recognizing, we're blowing by time, so I'll just end here and then I'll pass it off to Al. kind of that true North Star around access again, that question when we asked youth, and it's over now 2000 because it's a bit dated, but 31% answered when we said, were you gone anywhere if this service and platform and technology didn't exist? And 31%. So this is thousands of youth that said, no, I wouldn't have gone anywhere. So I'll pass it off to you, Al. We have 10 minutes left.
So when I was designing the co-design, how we were going to co-design this, which we started very early in our process, we recruited our youth council and family advisors in 2018 when we were starting this work. And we kind of looked by this, which is called the Heart's Ladder of Participation. And for us, we had always aimed to at least be above a 6. There's some things about this project with our various stakeholders being young adults, caregivers, and our service providers, where they weren't going to have complete control over it, but their ideas that they really loved, we really wanted to make happen. We didn't start this platform with this idea that we would have My Story or this idea that we would have Inbox. So these are kind of parts of those platforms that would be at like a 7 or an 8, because those are the ideas that came from young people and that we just made happen. And we have a very large backlog with all these ideas we're going to build over time, and a lot more other ideas that were championed and asked for by young people will be added to the platform with time. We'll go next. So we had when we started this group, we had over 20 young people. That was about 50% Indigenous, with a focus on rural and remote communities. And we did that on purpose because Foundry has other youth councils that have representation from Foundry centers. And so we really strive to get voices from young people outside of Foundry center communities. And so they've co-designed everything that you will see in my demo. And they co-design not only the features that are in the app, but the services that are offered and how they will be offered. And I remember having a really cool conversation before we launched Foundry's work in education program at Foundry Virtual, where one of the folks who was an artist said, I understand that some people want traditional jobs or want to go to traditional school, but as an artist, I will always be an entrepreneur. And I'd really love it if somebody in one of these programs could support me with that. And so there was a lot of really cool ideas that they had that they brought forward. There's a list here. I won't go through it, just running out of time, of a lot of the exact things that they supported. And here we see a quote from one of our young people who lives in Powell River about how building kind of the service that she really wished she could have had is really helpful to her, and really was really grateful to be able to give this service to her community. So and then I think we're going to next. I'm going to just do a very quick demo. If somebody who can you give my my phone, which is called demo, the ability to share screen, please? Thank you.
Ben, confirming we're okay with time, 5 minutes. Is that okay? Okay, we got the thumbs up now.
Cool.
Yes, please continue.
So this is the Foundry BC platform. When young people and family members download this platform, they're first taken to what this is called, which is the Foundry tab. And here this integrates with our website. Young people and family members in the co-design process talked about sometimes they just want to read and learn before they access services. And so this gives them one place to be able to do that. You'll notice there's little icons with downward pointing arrows, and that is just being able to save articles for offline reading. And again, because young people and family members talked about wanting to read and being that learning place, but not always having Wi-Fi or access to data. So this would allow them to continue to read as they go to a Foundry center or commute between home and school. The next tab you see here is called the Connect tab, and this is where everything happens around booking appointments. So I'll go from the top down. At first, you'll see Foundry Center, and you'll see that this young person is currently connected into Foundry Virtual. They can then, because they have a postal code that's put them in Richmond, they can also access Foundry Richmond, and then if they switch that'll just change in over to Foundry Richmond. We'll just go back to Foundry Virtual for now. Here they have a At the top, there's drop-in, so that's our same-day services. So any young person can show up and access the services Tuesday to Thursday 2 to 6, and they'll be seen that same day. And once they're in there, once the service is open, which it opens in 3 minutes, we can book. They can choose counseling, choose peer support, or choose not sure. And not sure was something that our young people advocated for, also because sometimes they don't know what they need. So having something there as an option to book that, and then a peer supporter will support them to learn what they're looking for and what the best service for them would be. If they don't want same-day services, but do want services in the next 3 days, for example, they can schedule an appointment. They're able to come in here, pick a service that they're looking for. I'm picking youth counseling. And then when they pick the service providers, they're able to see the service providers who have appointments available in the next 3 days. And the people at the top are the folks with the soonest available appointment, and people at the bottom are folks with the furthest available appointment. And they can search by things like pronouns. So if you're looking for a counselor that uses she, her pronouns, or they, them, you'd be able to search for that. Once you click in that, you can see the available times for a counselor and pick the time that works for you, and then pick how you want to join the session. So you can do a video, audio, messaging session, or phone into the session. And the counselor would be able to see that. There's also the ability to view your schedule, where you could see upcoming appointments. This is an appointment I have with myself. And here I can see that my appointment is coming up. I can launch my appointment. I can also use these phone numbers below and call into my appointment. And this just is helpful for us to, for the young people to go in, be able to launch it, and then it'll launch into Zoom. I can't join 2 Zoom meetings at once, so I won't launch it right now. And it all stays in the same application for young people and families. So they don't need to download anything else or go anywhere else. They're also able to delete appointments if they're deciding not to come. Lastly, there's also the inbox, and I can see here that I have an open conversation. So here I'm able to respond to this conversation, and my service provider will see receipts that when I have seen the message, and when I have not, when I haven't read the message yet, and the young people and family members don't receive receipts back. And that was something that our young people and family members had asked for. They understand that service providers are very busy, and they know that somebody might read their message and respond a couple hours later. So they don't want to, as a young person said, I don't want to be left unread by my counselor. So they don't see that information back. And through here, you're able to send messages, and you're also able to send links. Lastly, we have my story. So you're able to write and share a story and include a picture, which I have done here. And then you're also able to have stories that you're not currently sharing that you're working on, or maybe you have the ability to switch about what story is shared with who. So if you're meeting a primary care practitioner and you want to share something that's more relevant to that scope of work, you could write that story and switch it when you are sharing that. You can only share one story at a time. I'm gonna just stop it there. There's a little bit more that's available in this application, but we're at time, so I just wanted to end it there and ask folks if they have any questions.
Yeah, thanks, Suhail. I just want to quickly say, Ben, because I just even see some people in the chat there that we recognize, and I know maybe I just want to do this, but that this kind of innovative technology takes partnerships, and I can see folks from PHSA like Dominic and others that have supported Zoom, and our partners with the BC government for funding this, and our vendor in Victoria called Freshworks, which I got bought up by Ernst & Young, and obviously the youth, and it just takes a huge village to do this type of work. I just want to acknowledge those partnerships and thank for the folks that are on the chat here. Thank you for being involved.
Well, thank you so much for our 2 equally cool presenters, Suhail and Al, for their wonderful presentation. And I know I speak for myself, I always love a demo, so nothing beats a demo, right? To see what it actually looks like. So for people who will be watching this later on the recording, you've just seen a presentation on the process of developing the Foundry app and co-design process with youth. Unfortunately, we are out of time in terms of keeping Suhail and Al for live Q&A, but just like before, if people want to keep entering all your questions into the Zoom chat box, we will make sure we will forward these questions to our presenters and they will get a chance to respond later on.